Good afternoon. My name is Alden Landry, and I'm the Assistant Dean for the Office for Diversity, Inclusion, and Community Partnership here at Harvard Medical School, as well as an Associate Professor in Emergency Medicine at Beth Israel Deaconess Medical Center. I wanted to welcome you all today to our webinar, which is going to be on orthopedic residency opportunities at the Harvard-affiliated hospitals. Today's program is part of the Office for Diversity, Inclusion, and Community Partnerships Visiting Clerkship program. The mission of the DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure academic medicine and health policy, and provide programs that address crucial pipeline issues. Under this umbrella, the Visiting Clerkship program has been a model for excellence, offering outstanding medical students, particularly those coming from underrepresented groups in medicine and those addressing issues and inequities in healthcare, an opportunity to participate in externships at HMS and its affiliated hospitals. Since its inception in 1991, over 1,600 students have completed our program. As part of our outreach, we host a series of webinars each year to bring members of the HMS residency programs as well as our medical students together to share ideas, provide support, and address questions on transitioning to the next stage of medical training. These webinars provide an opportunity to discuss the application process, address questions from students regarding away rotations, as well as other concerns students may have. This year's webinars will include ophthalmology, orthopedics, urology, physical medicine, and rehab. The dates for these programs, as well as contact information, will be listed on the final slide for today's presentation. For a couple of housekeeping notes, this webinar is being recorded and copies will be sent to all participants in addition to being posted on the DICP website. The chat function is turned off, but if you have a question for our presenters, please post that in the Q&A session. A short survey will be posted at the end of the webinar that we would appreciate you take a brief moment to complete before signing off. Now I'd like to introduce our panelists for today. So first we have Dr. Chris Bono, who is a professor of orthopedic surgery at Harvard Medical School and a member of the the American Academy of Orthopedic Surgeons, Cervical Spine Research Society, as well as the International Society for the Study of Lumbar Spine, holding or having held many leadership positions in these societies as well. He is also the current editor-in-chief of the Spine Journal, which holds the highest impact factor among journals dedicated to the spine. He specializes in cervical spinal stenosis, cervical myelopathy, and cervical disc herniations, lumbar spinal stenosis, lumbar disc herniations, and lumbar spinal listhesis, and has participated in the interest in management of lumbar and cervical degenerative disease. He is a national and international leader in spine research and evidence-based medicine, enabling him to incorporate the latest treatment data into patient discussion for informed surgical decision-making. We also have Dr. Lorena Pineda. She is a double-boarded trained orthopedic surgeon in sports medicine and foot and ankle reconstruction surgery. Her clinical interests include the treatment of foot and ankle deformities using minimally invasive techniques that allow for faster recovery, less postoperative pain, and equivalent long-term outcomes as open techniques. They also include sports-related injuries, cartilage, ligament, and tendon disorders in the foot and ankle. Outside of the operating room, she has an interest in teaching and leadership. She is an active member of the Diversity, Equity, and Inclusion Committee of the American Orthopedic Foot and Ankle Society. As a member of an academic institution in healthcare, she aspires to contribute to work towards an inclusive environment for our patients and for the future residents and fellows for years to come. So with that, I want to turn it over to you, Dr. Bono, for the first question, which is, tell us about your program.
Great. Well, thank you very much for the invitation. And I'm very happy that that Lorena is going to be here with me. She's one of our outstanding, relatively new faculty. We have newer faculty than Lorena now, but she started a couple of years ago. It was one of our foot and ankle fellows before that. So I want to introduce you to HCORP, which is the Harvard Combined Orthopedic Residency Program. I became program director this past August, August of 2022. Next slide. And just to let you know what makes H Corp a little bit different, so you just understand our background. It's comprised of 4 different academic medical centers. So Mass General, which is where I work, Brigham and Women's, which is where I used to work for 12 years, Beth Israel, where I almost worked because I interviewed for the chair job for there, and Boston Children's Hospital, where I spent many times in the emergency room with my kids, because that's where I ended up bringing them for lots of their injuries. Next slide. So these are the pictures of the chairs of these different institutions, the departments of orthopedics at all of these institutions. And the reason I put the pictures up is not for you to memorize what they look like. But this happens to be the most diverse executive committee that we've had, I think, ever in the history of our program, where we have 1 woman, 1 Latina, 1 Asian, and then good old white Mitch Harris. And they as the chairs of all the individual hospitals, they make up the executive committee of the residency, and then I kind of answer to them as the program director, which is different than most programs in the country, where you have 1 chair, 1 program director, 1 academic medical center, and that's it. Next slide. We have 60-ish residents, and I say ish because it varies. Even though we match 12 a year, well, we have certain folks who are on a research year, so that'll mess up with the numbers. So some years we may have a little bit more, some years we may have a little bit less. I have the pictures up here just to get a sense of the diversity, just at least morphologically of our program. I would say the only thing that makes us not diverse is every single one of these folks loves orthopedics, and you know, we're all in the same mind. But really come from many different backgrounds, and this is really across the board for all of the years. This is something that has taken effort, and my predecessor George Dyer, who was the program director for 10 years, really put in a lot of time and effort to get us to this point of being such a diverse program. I think now we have that momentum, and we just have to keep it going. Next slide. So amongst those 60-ish residents, they are going by rotations in all these different institutions with 165 different faculty members. And this is both a strength, and some people feel like you know, maybe a little Achilles heel of our program. You can't get to know 165 folks, but we have every single subspecialty represented, and even super subspecialties. So we have children's at Mass General and at the other hospitals as well, people that are not only, let's say, a specialist in hand, but in pediatric hand, and maybe not just a specialist in shoulder, but of a particular shoulder pathology. We also have full breadth of research, from basic science to translational to clinical research, and really enjoy our relationship with the School of Public Health. Next slide. And that's it. I don't want to flap my gums for too long. This is to answer your questions and to get a lot of the information out. So I'll leave it at that. And Lorena, do you have anything else to add?
Well, good afternoon, everybody. Thank you for the invitation to be here. I think spaces like these and opportunities like these, I think, are great, and I'll encourage all the attendants to ask questions. We're more than happy to answer different questions about our program. I have the opportunity to do and been in many different institutions during my training, and I have to say that this program has a lot of diversity, which makes me very proud and very happy of being here. The residency program usually have a lot of diversity. The female presence is very strong, and I feel very passionate about it. So please make us some questions. Otherwise, Alden, I don't know if you have some questions that maybe in previous years are common, and be happy to answer any of them.
Awesome. Thank you both for your comments. And I think it's a great way for us to sort of segue into this general big picture question that I'll toss to you, Chris. As a program director, what are your overall thoughts about this application cycle? How is it going to be similar to past application cycles? And maybe more importantly, how is it going to be different than upcoming cycles, than past cycles?
Yeah, it's a good question. I think that there's always anxiety about the application cycle because we're dealing with very overachieving people who are coming from many high-powered institutions, and this is a competitive field. So orthopedics is tough to get into. What's different this year than previous years? The board scores are gone, so we will not have Part 1 board scores at all. Part 2 board scores, we are instructing our students to take Part 2. We don't know how every program is going to use Part 2 scores. I've had some people freak out because they didn't do as well on the Part 2 as they wanted to, and the cutoffs that have been previously established and known for Part 1 do not necessarily translate into what we're going to use for Part 2 scores. The signaling was used last year. It was brand new. This year it'll be a little bit more established. The other things that the questions that we're getting asked, what's going to be the cutoff and the metric for determining who gets interviews? Our program is going to be looking at research numbers as well, publication numbers. So I would say that's new for this year.
And for you, Lorena, when you're talking to students and students are coming to you and they're interested in applying to orthopedics, what are some of their concerns that they're expressing to you about this application cycle?
I think research is evolving and getting more and more important within our application. I think before, especially because orthopedics are very competitive specialty, it has been always something to keep in mind. But now that we don't have a step 1 scores, definitely we're grabbing different things where we can actually see or learn more about each applicant in an individual way. So definitely that will be something that I will encourage the students that are interested in, like maybe doing a little bit more emphasis in that. I think approaching anybody that they feel can be a mentor in the field that they're interested on, in this case orthopedics, it would be always good. I think at least I can speak for all my partners in our program that we're very open to talk to you, to have you in our clinics, in our ORs. Sometimes there are questions whether, like, I know I want to have a surgical specialty, but is ortho right for me? I think having a closer approach to what we will be facing as a surgeons, as providers in orthopedics will give you that last the last impulse to say, okay, this is what I want, or this is not what I want. I think I'm convinced that everybody that goes into ortho or any specialty should be feeling it, like, this is what I want to do. That's what makes you success in life, that you really love or passionate what you do. So we want to have any applicant that is passionate, that really love orthopedics. As Chris says, there's something in common among our residents. So if you have some doubts, I think having a close approach to the specialty will give you a good sense. And it will give you an opportunity also to have a mentor, to have somebody who knows you closer. And that will bring good letters of recommendations. If somebody actually knows you more than just in a piece of paper, will feel more confident to talk good things about you. I think that's also a good thing to get involved and have increase the chances of getting a good application.
Thank you for that. It's you hit on some points that we're going to talk about further in our discussion, but I think you gave a great sort of start off to this presentation so far. Chris, you mentioned some of the work that your predecessor was doing, and you showed the diversity amongst the trainees that you have in your program. What is in the works to help continue this effort around having a diverse residency program?
Yeah, it's a really interesting point, and what Dr. Dyer had to do is he had to call out that those last minute little changes that were assuredly made based on unconscious biases. We'd like to think that we're in a field and amongst colleagues who are not, consciously, purposely, swaying things one way or another. But when George and I talked, he said, "Listen, because I had my first ranking meeting." So that at the 11th hour, so and so is going to come up and say, "Well, I talked to my buddy, and he said that this person's really good, and we have to move him up." And then there are other times where it's like, it just doesn't, this person just doesn't fit in, and what's the reason? And his advice was, be as objective as possible. So what I did this past year is every single rotator came through as a sub-I, both home institution and external. We had open discussions. And if it was a case where I suspected, hey, why are we trashing this person? I said, let's think about bias. Are we being biased here? And got the whole group involved so that we're bringing it to the fronts of our brain and to the conversation, so it's not hanging there in the background, and then making sure everyone has a voice. So that's one way, and really just being inviting to have these these conversations and have them open. And like I said before, George has gone over the hump. He's gotten us the momentum, and now with that momentum, I think that we really get a lot of applicants who state, flat out when they're coming, it's like, we know that this is a diverse program that's very open to all kinds of applicants, regardless of backgrounds, and that makes us comfortable. So that's what we're doing, and it really comes down to that very last, submission of the rank list, but that it's groupthink and not being swayed by one or two individuals, because everything will have a regression to the mean eventually.
Awesome. Lorena, as we're having this conversation, we know that there are some students that are listening that are going to be watching this later on, that aren't actually in this application cycle, but they're interested in orthopedics. They haven't committed to the specialty just yet. They're probably in their second or third years, but they're leaning heavily towards pursuing a career in orthopedics. How do you decide if orthopedics is the right specialty for you? And what tips do you have for students to say, yes, being an orthopedist is amazing, this is the best specialty ever?
Yeah, that's very easy for me to answer. But so tools that I think for second, third year medical students are very useful. For example, for those that are in Boston, there is this program called Bones. And it has been here for over a few years, and it's an activity that is like a morning on a Saturday. It's directed for a lot of women. We have a lot of women orthopedic surgeons in the field in our program, and even like different colleagues come, and we offer the opportunity to actually do a workshop. So we go in sub-ons and we experience what we will be doing in the OR. We put in screws, we put in nails. We also at the end have an open discussion to answer all different questions, like how is the environment? Is it welcoming? Is actually things changing? It's always like from the outside, the perspective is that there is a lot of discrimination, or there is comments that just makes me feel uncomfortable. So we're open to answer all those questions in a first-hand basis, or how you can approach different things, like I'm not very tall, I'm skinny. Like, I know you guys are seeing me here, I'm sitting, but I'm 5'4", tall, and I weigh 120 pounds. So I'm not too big. I kind of got used to use a step stool when I was doing my training, because I was working with people that it was 6'2", and it was totally fine. I learned how to use my body weight, to use different tools, to actually have a good technique to reduce different bones. I actually make a comment about an experience that I had when I was a resident, reducing a hip in the ER. And like, you just learn how to do it. And I think during your training, there is so many people supporting you that they actually show you how to do it. I learned how to use my body weight actually for a lot of attendants that are male. and they knew that I have to use different tools because I wasn't a stall. So I think all those things are there. And different activities as bonds, for example, is a good opportunity. People that is outside Boston, there is the NTH Dimensions. There is a program that actually you can do a summer internship, and they also expose you to different workshops and how you can actually learn more from our specialty in a different way without having the pressure to be one-on-one with the program, but just like an open for a few months and said, okay, is this what I want? Is this what I'm interested in?
And Alden, I just want to add one thing to that. For a lot of people are attracted to orthopedics because we're happy. You know, we're a happy group of people. We get along, and it just seems to be a lot of fun. Make sure that if you're deciding to go into orthopedics, that not only do you like the people that are around you, but when you're in the operating room, just as Lorena's face lit up, it's like, that's easy to answer because I just love this. Is that you just can picture yourself doing this and you can't imagine doing anything else. That's how you know you're meant for orthopedics.
I love it. Chris, I'll stick with you. And I think you mentioned something about looking at research numbers as part of your evaluative process for applicants. But there's been a lot of discussion, particularly in orthopedics, about students taking an extra year to do research to go in as part of their portfolio as they prepare themselves for applying to orthopedics. What are your thoughts on this? What are some of the pros? What are some of the cons on either side, whether doing medical school in 4 years without the research year or doing that 5th year for research?
Yeah, very, very common question. Also becoming a more popular question and more popular practice. Take a research year off. Some people are not doing just the year of research. Some people are getting a degree. I would say for research, yes, the research numbers are becoming more and more of a measure. They're becoming more of a measure, not because you need to come into residency being, super good at doing research. It's just a sign of your commitment to the field. If you're an MS1 and early on, my advice is when I meet with the MS1s or 2s and you're interested in orthopedics, start to get research under your belt. There are some that decide a little bit later, MS3, and they may not have any research under their belt. Those are the ones, if they are interested, I say, you might want to take a year off and really crank out a bunch of publications and get as much, because you are going to make yourself look better for the application. I hate that that's where we are, because 25, 26 years ago when I applied, it was not like that. And, you're not adding tacking on a year to your training and to draw this process out. But I think that it's becoming more necessary. As far as the extra degrees, I don't think that getting an MBA, which is a very common degree to get during medical school, helps you. Do it because you absolutely want to do it. And if anything, be prepared to answer the question, why did you choose to get an MBA in the middle of medical school? How do you think that's going to help you be a good orthopedic surgeon or, afterwards?
Yeah, that's really thoughtful. And it's interesting how some degrees may be helpful and others may not be as helpful. So it's an interesting discussion. Lorena, did you want to add something?
Yeah, so I saw a question in the question and answers. Maybe we can answer it live. It's about how we have, if the residents rotate in 4 different institutions, how do we ensure that all residents have similar experiences? And probably Chris is the best person to answer that, but I just wanted to make sure we answer that question before we keep going.
Yeah, no, I saw that question. Yeah. Alden, you want to do it now or later?
Yeah, go ahead. That's perfect. Go ahead and you all can answer that now. It's a great question.
Yeah, it's a very good question, because we do have 4 institutions and they are very different. You work with very different attendings and maybe even a different group of residents. We haven't been very good at making it uniform in the past. This year, we're making a concerted effort to having a uniform rotator curriculum. We're going to have an orientation with expectations to the sub-internships. So we're trying to make it as unified as possible. And we have lecture series happening in each of the institutions that will make it more uniform. At the end of the day, it is, even if you're at the same institution, you might be on, two different services and have different experiences. So it's never going to be 100% uniform, but we are trying to make it as best as possible. And I think that exposing yourself to as many faculty members and as many residents while you're here, not necessarily just on the service that you're assigned, is really the key.
Yeah, Lorena, did you have any thoughts that you wanted to add as well?
No.
Okay. So, going back to our other questions, I think that a lot of students are in this space where they're trying to make sure they have their ducks in a row before they apply. Chris, can you talk about what students should have on their application when it comes to rotations or experiences that they've done before that, September timeline when they're about to apply for orthopedics?
Yeah. So by the time they're applying, they should have done at least their home institution rotation. The home institution rotation drives the letters. So we recommend a minimum of 3, usually 4. You want one person that you did research with and not necessarily clinical experience. You want one letter from that person, and you want the rest of the letters to be people that you've worked with clinically. Because what programs want to know, is this a person that can work with a team? Is this someone who's honest and reliable and the residents trust and can kind of just jump in and get the work done and anticipate the next steps? That's probably the most important thing. Prior to that, and again, it's not a last minute thing that you can do. You want to make sure that you have your research and your publications. The other stuff that is becoming increasingly popular is, what have you done as far as community service and outreach? And I hate that it's going to be a checkbox, but it's something that we look for, and maybe that's a good thing because we're putting a priority on it. But what have you done for the underserved in the community? What have you done in your local? Have you done anything globally? Have you gone overseas? And it doesn't. There's not one mold to it, but we're looking for that as well. Something to set you apart and show that you're committed. So I think that those are the things. Now, as far as rotations, you definitely want to have done all of your surgery clerkships and get an honors and those and try to, and that doesn't even matter because there's no more grades, so I keep forgetting. But another common question is, should you get letters from non-orthopedic surgeons? I mean, if someone's going to write you a super stellar letter and you've worked with that person for a long time, maybe. But at the end of the day, programs want to see letters from people that they know and trust and give them a reliable judgment and someone they can give a call and say, hey, is this person really that great? And that's not going to be, a pediatrician. It may be a pediatric orthopedic surgeon, but not, not someone that we don't know personally.
Sticking with that narrative, Lorena, as you are looking at students' applications and you see comments from, a surgery rotation that they've done, whether it be general surgery or some other subspecialty within surgery, are there certain things that you're looking for as far as those evaluations? Are there buzzwords? Are there things that you commonly see of students in their applications that make them stronger applicants for an orthopedic residency program?
I think things that light up when I read a letter of recommendation is that discipline, the student is committed, has discipline. For example, I think that's why letters from somebody like that, the researcher, have worked with them in a consistent basis, give us a lot of information, because it's how the continuity of the student has in the different projects they have been involved. And that can be in research, but also can be in clinical. Like, for example, if a student went and rotate with you only one day and then didn't go again, it's hard for whoever is writing the letter to talk about those things, because it's 5 years of residency and it's a life doing this. So we need to make sure that it's somebody that is committed to what the role, even if it's a residency program and like an applicant, then later on when they're become an orthopedic surgeon. So that's one of the things. And other thing that I personally think is very important is that how the interaction it is. Like if they're like if they feel like they're enthusiastic, they actually are they're willing and open to give ideas. Like they are open to discuss and actually say what they think when they interact with their mentors that is right in the letter. I don't know if Chris probably has more experience than me and has other tips for the letters of recommendations of what we're looking at.
What we really, I agree with everything that you said, Lorena. What we really love to see is this is, standout. This is a standout candidate. Top 1% of people that I've worked with ever. But you won't see that. You don't, as an applicant, you don't see that. How do you get to that point? You have to go above and beyond. And that's what we're looking for, because this is a field that requires that. When it's 3-4 o'clock and you were scheduled to leave, but the case is still going on, you don't wave goodbye and say, "Yeah, I have, I got to go. I have to go get my haircut." That's if you want a bad letter, yeah, you could do that. But if you want a good letter, it's like, just we're in there. What else do you need? Do you want me to hold the leg, this way? Just be as helpful as you can. Not telling someone how to do an operation. Just, whatever I can do to make this better on the clinical side. It's all about that commitment and that love to be there, because you just can't get enough of it. That's got to show. That's got to be very apparent to your letter writers.
So, we're talking a lot about letter writers, and one of the ways that students actually get letters is away rotations. I know that we have the visiting clerkship program, and we often get students that are coming for orthopedics. They often come in sort of that August, September, maybe October timeframe. Chris, can you talk a little bit about the value of away rotations, timing of away rotations,
Yeah.
and how students can just do their best when they are on those away rotations?
Yeah. Away rotations are hands down the single most important thing you can do to get into a program. It will set you apart. There's nothing better than clinically getting to know somebody for a month that otherwise on paper, may look exactly like somebody else. The letter that you get from those away rotations, I think you always have to be a little bit careful, because if let's say you're applying to 30 programs, but you did 2 aways and you send every single one of those programs the 2 away letters, you're like, oh, it's very clear this person wants to go to program A or program B, not ours. How do you impress somebody? You want to be yourself. You don't want to put on a show, and anyone who thinks that they can put on a show, eventually cracks will form there. But it's anticipating what the resident, mainly, because you can be working with the residents, what the resident needs. When you're on call with the resident, you go down to the emergency room and you pick up on the first couple consults. Okay, this is a distal radius fracture. What's the resident going to need? You go grab some plaster or fiberglass, some web roll. You have splint material. You know where stuff is. That's the kind of stuff that a student can do and make a resident's life easier and better. That's going to make the resident say, whoa, this is someone who really is anticipating the next move, is a team player. We're all trying to get through this together. And then in the operating room, when you are in a case, anatomy. When your responsibility as a medical student is to know your anatomy 100% cold. You're not going to be asked, the 3 different treatment options for, a spinal fracture or subtalar ankle arthritis, but you will be asked, what are the planes of motion of the subtalar joint? What are the articulations? And I can't even answer those questions, Lorena, anymore. It's been too long. Those are the things that are going to make you stand out. Always be paying attention. You zone out. And sometimes it's hard. Maybe you're just holding retractors during a big hip case and you're zoned out. And then someone says, hey, what do you think this tendon is over here? And you're like, oh, that's not a situation you want to be in. So that's really how you make a difference.
Another thing that I will add to that is if for some reason you don't know the answer in the moment, you admit it.
Oh, yeah,
Because if you start making things up, it's so easy for us to know that you're making things up. And it's okay not to know the first time, but then the next time that you see that person, you put another reminder in your phone and you actually go and read what that person asked you, and you just show them interest by answering exactly what they ask you, knowing that you actually went and look and study for it, and instead now I have the answer for you. Because not knowing the first time, it might be okay, but not knowing the second time is bad. And then if you show them actually that you went and look for the answer, you're also showing interest.
great point.
That really is a great point. And I use that same teaching in emergency medicine, and I'm glad to hear that it carries true for other spaces. Lorena, we want students to come and rotate with us. We know they're valuable. I think the VCP is one of the best programs that I'm a part of in the work that I do. But because of scheduling and conflicts and different timelines at different schools, not everybody is able to come and rotate with us. How can students, before the application process, learn about our residency program or any of the other residency program? Should they be reaching out to other residents that are in the program? Should they be reaching out to faculty? What's the best way to learn about a residency program before the application process?
So I will say that the first line of information are the other residents. So if you have a program in mind and you have especially from like the diversity perspective, like women in orthopedics, underrepresented minorities, if you have questions, concerns about how the environment will be for you, if those questions are related to those things, talking to the residents will be the best source of information. Like also just looking at as we show like the pictures, who is in the program. If you see there is like few women or diversity, that will encourage you. And if you want to know more about it, reach out to one of them and say, okay, how are things in the program? What is the program doing for include different things? Is it really an inclusive? What are the things that I should be prepared? No, it's more like how you present it. Like, don't present it like I'm scared, like I don't want to be in this. Because the reality is, like in every field, we're gonna be facing moments that will take us out of our comfort zone. But what we want is have a supportive environment, that when we have those moments, we have somebody that give us backup. So we want that. We want people to be understanding when we're having different situations, and maybe somebody that is not a female or that is not from underrepresented minorities wouldn't be facing. So we want to see if we have that support, because I can guarantee you that in different environments, no matter what specialty it is, you will be facing different moments and difficult moments during your training, but we just want to have that support. So reaching out to residents, that will be a very good way. And then if you want to know a little bit more, then you look at the faculty members. And if you are, for example, a female, you reach out to me, or you reach out to Miho Tanaka, which is one of our sports medicine attendants, and see and ask for specific questions. I think we're all very approachable. And I'm going to have 3 medical students, and 2 of them are from different programs that are doing kind of like a summer internship with me. They're like just shadowing me in the operating room, in the clinical setting. They are in second year of medical school, and they have some doubts. They just want to know that this is actually what they want. And they have been rotating with me, and they're going to be continuing doing that during the summer. And that's something that you can always do. We have a lot of research opportunities too, and that research opportunities comes for our residents, but also comes from any medical student that is interested. So there are many different ways. I think we're very lucky, and we have a lot of different resources for people to reach out to us, not only as the resident perspective, but also being a medical student.
Got it. I think that's really important. So thank you for sharing that. One of the things that often pops up in discussions is how to write a strong personal statement. And I always tell students, you need to make sure that it's personal and it's a statement. And I know that sounds corny, but oftentimes they're not. They become pieces of nonfiction work, or they become something that sort of really strays away from what we're looking for when it comes to our personal statement. So what is your best advice for these students as they're prepping their personal statements and they're going to be crafting, a story about themselves, knowing they only have a word limit or a character count that they're going to be up against? Chris, what do you like to see in those personal statements?
Yeah. In those personal statements, and by the way, when you said it's neither personal nor a statement, that it reminds me of some SNL skit. I forget who did the skit. But what you want to write in your personal statement is absolutely something from the heart, something that is very important to you, and is not something that you can learn from the CV. Whether it's an experience, a lot of people write about sports injuries, and I got to tell you, I can write the letter. I tore my ACL when I was in high school playing soccer, and my orthopedic surgeon fixed me, and that orthopedic surgeon was the greatest person in the world. I want to be that person. Like I look at that letter and like I don't know who wrote that letter, because I've read that letter 100 times, but I haven't read the letter 100 times where, listen, I came to this country by myself when I was 17. I didn't have any family. I started with community college, then matriculated into Stanford because I did so well in community college, and then developed this interest in orthopedics because of whatever it is. Like I know who that is. That's a faculty member who was one of my residents who's out in California in academic practice. I'll always remember that letter because that was unique to that person. That's the kind of stuff that you want to write so that when it's interview day, it's like, oh yeah, this is so-and-so who lived in their car, or this is so-and-so who, took a year off to take care of their parent because their parent was ill and sick and put everything else on hold. That's the kind of stuff that shows who you are and your dedication to the field, that this is what you absolutely want to be doing next.
Chris, I just want to let you know that we in emergency medicine also get those personal statements of when I was 9, I fell out of a tree and I broke my elbow. And ever since then, I wanted to be an emergency medicine doctor. So I think maybe the narrative here is let's move away from that and get a little bit more into, who you are and the why orthopedics, as opposed to just that one sort of interaction. It's great. We're excited that you love our specialty. We're excited that you love medicine. But there has to be more to it than that one interaction.
Great.
Another part of this process is the program signaling. And we were talking about this a little bit before we started the webinar. Can you talk a little bit about what's the current setup for orthopedics and how is it going to be used for this year's application?
Yeah, it's a good question. I'll take that one because it's new, relatively new. So last year was our first year using signaling. We're going to use it this year again. We did not use it as a make or a break. Like if you didn't signal us, that you didn't get an interview. We did use it as a differentiator though. So if we had people that looked very similar in their scoring of the initial review of their applications, and one signaled us, one didn't signal us, yeah, we went to the one that signaled us. So that's how we used it. I do understand from our conversations before that there's like gold and silver. We are not up to doing gold and silver just yet. We are still of the philosophy that we have enough faculty members to really grind out a review of 500 applications, which is what we usually do, and pick out our 64 interviewees from that with influence of signaling. I think other places are doing it differently, but that's what we're doing over here. There's not a unified consensus amongst all orthopedic surgeons, and it really depends on the relative competitiveness. There are some programs that can't afford to just go by the signaling, and then others that may say, "Oh, we're only gonna interview those who signal us."
For you, Lorena, this is a question I'd love to toss your way. When you're interviewing applicants, what are you looking for? And I guess before we get into that, do you know what the direction orthopedics is going to go with as far as virtual versus in-person interviews? Have you all discussed that as a society and also as a department?
Well, I think the virtual in person that Chris will give you better information about that. I can answer the part of like what I will be looking in an applicant and things like that. So things that I will look into an applicant are I want that person during the interview, and that's my advice for everybody, try to be yourself. And for doing that, you need to prepare. And the best way that you can prepare is actually before the interview, you need to know yourself. You need to know your strengths, and you need to know what are like the weaknesses, but are not really weaknesses. That are things that are not your strength. That's the best way. So when I interview you, I can see what is the value that you can provide by being yourself. Not the typical answer that everybody will give me, because there are some answers that everybody repeats, and then when I see that, I'm not seeing yourself. So I think everybody is unique, but just identify what are those points of the strength of your application of yourself, and how you can contribute to the program in a different way, and just embrace them. So when I'm asking you questions, you are yourself, you're looking into my eyes, like always try to make eye contact, and just be sure of who you are and talk about from that. You don't have to be perfect in every single aspect. We're not looking for that. Like there is not like a perfect person. You are a perfect applicant if you are yourself, and you just show us that you can contribute in different ways, because that's what we're looking.
And Chris, can you tackle that part about the virtual versus in-person interviews? Do you know what the general direction is going to go for orthopedics this year?
There's not a general direction. We had a lot of discussion about this at our past academy meeting, and there's a residency meeting within the academy meeting, and a lot of the discussion actually was surrounding diversity. Is that a lot of folks feel like the virtual rotations allow people who cannot get to a rotation because of financial constraints or whatever it is, that it kind of levels the playing field. Now, the reality is that this past year, we were all virtual because HMS told us, that was our only choice. If given the option, I think that we probably would do one more year of virtual. I personally feel like it is a level playing field, but there are mixed feelings about it at the executive level. There is certainly not a consensus amongst programs in the country, and I think it'll still be very divided.
Awesome. I think it's an interesting space for us to be in, because we've embraced Zoom in so many different ways and virtual interactions in so many different ways. But I think there is some value added to those in-person experiences with the interviews and so forth. Another thing that also happens is students want to communicate with programs after an application, after an interview. What is your stance on that? Is it appropriate to send that handwritten thank you letter? Should they be sending emails saying that we're going to be ranking, I'm going to rank you number one? How do you encourage students to use that communication sort of after the interview process, and is there value to it?
Yeah, I think that there is value to it as long as it's genuine. And what we don't want to see or to happen is that you get a relatively generic letter that says, I very much enjoyed meeting you and yada yada yada, and you're like, okay, this is kind of meaningless. I think if you reserve and hold back and use a little bit of restraint until you've developed your rank list, and at that point, it's perfectly appropriate, and if not, encouraged to say, okay, so-and-so program, I am ranking you one. You are my top choice, and people are advocating for you there. Of course, we can't tell you what we're specifically we're ranking, but we can tell you if you're ranked to match and all that other kinds of stuff. That's meaningful. That actually can move the needle on where you are on a list. But otherwise, handwritten notes, nice, not really feasible. Probably not going to make a big difference. Lorena, you swayed by a handwritten note?
No, I don't, but That's just a personal thing. I think like if you can do more when you're one-on-one with the person that is interviewing you. I think that's the best shot.
I'll be honest with you, the way the mail works in our hospital, if you send it to the hospital, I probably won't get it until after the application process is over anyways.
That's 100% true.
Lorena, I would love to know, you were in this process recently when you were thinking about how to rank programs. What should students be doing to put that rank list in order from a applicant perspective, not trying to game the system, but really thinking about where they're going to be the happiest after they've done their interviews and trying to figure out which programs is going to be their sort of best place for training for the next stage in their career?
So when we're talking about, for example, virtual interviews, and I think that's a great way because, we interview in many different programs, but after you narrow down, let's say your top at least 5, because I know traveling is expensive and you're busy, at least go to the city, go to the hospital, like go where you think that program will fit in for you. After talking to the residents, of course, and pretty much make a list. The clearer that you have what you're looking for in a program, the easiest is going to be for you to do that rank list. So go and see the city. Think about like different aspects, like go to the hospital, see how like every hospital works in a different way. Just have a little bit of a sense. Okay, I will be here 5 years. How do I feel about that? Like, like this is like exciting, or maybe I don't feel that connected to this hospital. Those little things will make a difference because overall, I think once you have your rank 10, a lot of the programs are probably going to be very good. So there are those little details that is going to make a big difference. So like the city, and if you, for example, have a partner or something, go with that person. So it's 5 years of our lives that if we have that personal support, it's going to be much easier to go through. Because the first few years, especially, it's a lot. And we're going to be in the hospital a lot of the time. That is our partner, spouse, whatever, who will be there with us. So we want to make sure they're also happy so they can support you while you're pursuing your dream or having the career that you want. So maybe go and visit different cities with that person if you have it. So look at those little details that it might make a difference for you.
I would love to tell people that it's always 75 and sunny in Boston, but it's not. So coming up to see Boston in some of the less ideal times is probably a good idea, just so you can survive a winter in Boston. As a Southerner myself from Texas, you can do so, and you can be successful in your career.
I agree. I'm from Colombia, and you just have to wear a very warm coat, good boots, and you will survive.
We're running towards the end of our hour that we have together. And I just want to see if there's any student questions. Feel free to put those in the chat. I wanted to go to you, Chris, with this question. Are there any other points that you think we haven't discussed about the application process, becoming an orthopedist, being successful in the match process with this upcoming year?
Yeah, I think that the only other additional advice, I think you asked all the great questions, all the very common ones. Be on time, be early. Don't wait for the last minute. Don't bother. Don't worry about bothering somebody if they haven't done your letter. This is your application. And it may be just a check mark on a to-do list for a faculty member, but just annoy that person. I know you may want, I don't mean, you berate them and say, you haven't written my letter yet, but please, Dr. So-and-so, I'm waiting for this letter. My application is due very soon. You can please submit it. Don't worry about doing that week by week. Get everything else done ahead of time. If you're applying this year, just make sure you know all the requirements and you're meeting all the deadlines ahead of time. If you are an MS1 or MS2, you don't have to worry about that right now, but your concern right now should be doing pubs, getting to know faculty members and residents. So it all depends on what stage you are in. And then once it's all said and done, do a great job on your away rotations, or that's actually before. and enjoy your interviews. Like, just make this an enjoyable process, because that will really shine through from beginning to end.
Lorena, do you have any parting advice for our listeners and viewers?
Being aware that things in medicine, we have to be big planners. It's just like 1 year is not enough. So as soon as you have decided what specialty you want to be, if it's orthopedics, of course, we'll be very happy. But even if it's any other specialty, you just need to be on top of that. Like, get involved in that specialty as soon as you find what is actually your passion. And I agree with Chris, like having everything with like a lot of time in advance, because whoever you're asking for a letter or an advice, it will be so busy, but this is like a big part of your life. So don't worry about it. But and always, and be on time also when you're showing up to things. Not only like, writing an email, but like being on time, being there, being on time, that makes you look good all the time. So just be mindful of that.
So with that, we want to say thank you to Dr. Bono and also to Dr. Pineda for joining us and sharing your insights into the specialty of orthopedics. We are looking forward to students coming and joining us for rotations. We're looking forward to seeing you on the interview trail. And most importantly, we're looking forward to seeing you match in our residency programs and being here with us at one of the Harvard affiliated hospitals. Just going to click through a couple of slides. As we mentioned, there is going to be that survey that pops up briefly. The applications for the visiting clerkship program are still available. Today is the day for applications through the VSAS process if you want to rotate with us in September. But we still are accepting applications for students to rotate with us in both October and November. And the deadlines are presented on the screen. Next slide. We do have 2 more upcoming webinars. July 13th, we're going to discuss careers in urology. And June 20th, we're going to discuss physical medicine and rehab. And for those of you interested, we are going to be hosting our annual Harvard affiliated residency showcase. It's going to be in person and virtual on September 9th. And this is also a great opportunity for you to learn more about our programs, meet our program directors, and many of the trainees and other faculty members. Next slide. Please fill out the brief survey that you'll see popping up on your screen, and we look forward to seeing you. And copies of this will be made available to all those who registered to watch, and also will be posted on our website in the coming weeks. Thank you, and have a good rest of your afternoon. Thank you again, Dr. Pineda and Dr. Bono.
Welcome. Take care.
Thank you. Bye.